Bismillahirrahmanirrahim. Assalamu alaikum. Dear colleagues, in the last vlog, we had an overview of different psychiatric disorders which are common in our society. Today, we shall discuss the mood disorders. We shall see what do we mean by the mood disorders, what are the common types of mood disorders, what are the causes and risk factors that someone develops these mood disorders, and then we shall see and discuss how these present to a doctor and how the diagnosis is made. And once diagnosis is made, what treatment is offered to these patients. So we shall see the answers of all these questions in our today's vlog. As mentioned in the intro, topic for our today's discussion is mood disorders. So what do we mean by the mood disorders? Mood disorders are mental health conditions characterized by disturbances in emotional states, affecting thoughts, feelings, and behavior. I repeat, mood disorders are mental health conditions characterized by disturbances in emotional states, affecting thoughts, feelings, and behaviors. What are the types of mental disorders which we see around us in our community? The common mood disorders are, number one, major depressive disorder. Major depressive disorder. Number two, bipolar disorder. Number three, dysthymic disorder. Number four, cyclothymic disorder. Number five, mood disorder due to a medical condition. Number six, substance-induced mood disorder. And number seven, premenstrual dysphoric disorder. So these are the most common 7 types of mood disorders which we see in our community. We shall discuss the first 2 types, major depressive disorder and bipolar disorder, in some detail, as these are the most common ones. When we look onto the major depressive disorder, how the person who is having major depressive disorder, what are the symptoms, how he or she presents. There is persistent sadness or hopelessness. He or she is constantly sad and hopeless, having no hope from the life, having no hope from the relatives, having no hope from the system. So persistent sadness or hopelessness is one presentation of the major depressive disorder. Such person has loss of interest in activities, don't like to be involved in games and social gatherings and other social community activities. There is changes in appetite or sleep. They feel fatigued, lack of energy, asthenia, aches and pains. And they feel difficulty in concentrating on any goal or any subject. So a patient with major depressive illness, a major depressive disorder, will be having persistent sadness or hopelessness, loss of interest in activities, changes in appetite or sleep, fatigue, low energy, and difficulty in concentrating. What are the subtypes? The major depressive disorder has got at least 3 major subtypes. First is melancholic depression. Second is atypical depression. And third is postpartum depression. After the childbirth, the mother goes into depression, and this is one of the type of the major depressive disorder. Let's see how the major depressive disorder is different from the bipolar disorder. And bipolar disorder is not an uncommon one. It is really common in our community. Person having bipolar disorder, bipolar means 2 poles. Her personality swings between the 2 poles, extreme sadness, extreme happiness, extreme hopefulness, extreme hopelessness, extreme positive and extreme negative. So there swings between 2 poles. So such people, they are manic or hypomanic episodes, become very happy, very excited, and then they become depressed at times. So there's episodes of mania or hypomania and episodes of depression. Their mood swings between the 2 poles. They've got increased energy or activity. This is one of the features of them. Impulsive behavior. And then this bipolar personality, it can be divided into at least 3 subtypes: bipolar type 1, bipolar type 2, and cyclothymic disorder. We won't go into the detail of the subtypes of depression and bipolar because it will become more medical. As a whole, difference between the major depressive disorder and bipolar is that major depressive disorder, they're always depressed. Their thoughts, their feelings, their behaviors, their insight, it's depressed. While in bipolar, there swings between 2. Being very happy, being totally unhappy, sad. Being very energetic, being just on the other side. Being very positive, being very negative. And you become very strange that how this person was very happy yesterday is totally depressed today. So, and you get confused. So bipolar personality is very much there. So let's see if a patient has got mood disorder, why he or she develops this mood disorder. What are the causes of mood disorders? Most of the causes we have discussed in the last vlog, but here just to review the causes, specific causes are the causes specific to mood disorders, and these are of course genetics, changed brain chemistry, life experiences, medical conditions, substance abuse, and family history. So all those causes which we had discussed in the previous vlogs, they are very much operative and contributing in the mood disorders. How we diagnose someone with mood disorder? Of course, the same parameters: comprehensive diagnostic evaluation, psychological assessment, medical history, physical examination, and diagnostic criteria, DSM-5 or ISD-11. And once we diagnose that some person has got mood disorder, and whether this is major depressive disorder or the bipolar personality, then we offer them or we treat them with medications, with drugs like antidepressants, mood stabilizers, and antipsychotics. And similarly, we offer them the psychotherapy, which includes cognitive behavior therapy, interpersonal therapy, and psychodynamic therapy. What are these therapies? It's not the place, it's not the forum to discuss these. This will be your doctor will offer you, but these are the ways, additional ways of treating mood disorders in addition to the drugs. And of course, the lifestyle changes, exercise, mindfulness, sleep hygiene, and social support. I'll do discuss the mindfulness and sleep hygiene with you in my other YouTube channel, that is the personal development. There we shall discuss all these because it comes under the domain of that what's mindfulness, what do you mean by the sleep hygiene, what are the biochemical basis for the sleep. So we shall discuss all these there. But here you remember that these are the additional tools of managing these patients. So dear colleagues, in today's vlog, we discuss the mood disorders. What is the mood disorder? What do we mean by that? And we discuss that the mood disorders are mental health conditions characterized by disturbances in emotional states affecting thoughts, feelings, and behaviors. And then we discuss different types of mood disorders, out of which the two important are the major depressive disorder and the bipolar personalities. Then we discuss the causes and risk factors for these, and then how they present and how they are diagnosed and what are the treatment options for these patients. So I end here. Inshallah, in the coming vlog, we shall take another psychiatric disorders and we'll see that in detail, that what do we mean by that psychiatric disorders, what are the causes of that, what are the types of that, and how we can offer treatment to those patients. Till then, take care. Khulafis.